Good morning, everybody, and welcome to the March 2026 Hospital Stakeholder Engagement Meeting hosted by the Colorado Department of Healthcare Policy and Financing. Now that we are 5 minutes after the hour, we can go ahead and get started. So let's go ahead and move to the next slide, please. Okay. Once again, welcome. My name is Andrew Abalos. I am the Facility Rate Section Manager here at the department. We have a few of us who are presenting today, and they'll introduce themselves as their topics come up. But once again, thank you for attending these meetings. We really do count on your participation to make these meetings successful. We find these meetings to be a useful way for delivering useful information to our hospital stakeholders and collecting feedback on any of the initiatives that we are proposing. So thank you for your attendance. Next slide, please. So just a few ground rules about this meeting for those of you that may not have attended before. As you may have gotten an alert, we do record these meetings, so we will be posting this recording to the Hospital Engagement Meeting website for later viewing. The timing around that is we usually get those posted around the first few days of the following week of the meeting, so we can count on getting those posted then. And we do like to encourage hospitals to talk during these meetings, or hospital representatives. So if you do plan to speak, just make sure that you mention your name, the entity that you represent. This is helpful for us to follow up potentially after any meetings in case we need to continue any dialogues that were brought up. But also, if you do intend to speak, please make sure that you are in a quiet area. We just want to make sure that we preserve the integrity of the recording. So again, we want to make sure that these are collaborative meetings. So we certainly invite discussion from of any topics of interest. So if there's anything that you would like to see discussed in these meetings, I encourage you to email Delafon, whose email address is listed on this slide. And we would like just a couple of weeks notice to prepare, just in case we need to coordinate with others to make sure that we can get them to speak to the topics that come up, and also so that way we can prepare in case we need to do some research on our end to address any topics. So thank you for your cooperation. Next slide, please. All right. So here is the remaining meeting schedule for 2026. As you might be able to observe here, we try to shoot for these meetings the first Friday of every odd month. The only exceptions are when we encounter holiday weekends around those times, and just to make sure that we have enough attendance, we push those to the following Fridays, and then instead of the mornings, we have those in the afternoons. This is largely so that way we don't interfere with the Medical Services Board meetings, which oftentimes we have to attend, and I'm certain that others who attend these meetings also attend those ones. So I just want to make sure that we would be able to attend both. Okay, and next slide, please. So we have a very light agenda for today. So certainly that leaves us some time for discussion if need be, but otherwise it allows us to get some time back on our Fridays. So in the interest of getting through it, I'll go ahead and move to the next slide. All right. So just wanted to address some topics that we've been hearing about from some hospitals. We have been hearing more about interest in graduate medical education funding, and we're thinking that we would want to perhaps introduce maybe a separate meeting to further those discussions, or contain those discussions within the hospital stakeholder engagement meetings. So we've only heard a little bit so far, but I think this would be a good opportunity to try and just solicit some more information from hospital stakeholders. Thinking about graduate medical education in the future, right now we have GME payments as they exist in our inpatient base rate setting. There is also the managed care lump sum payments that go through, and there is the regulatory authority for the state funding or the state teaching hospital payments. So I know that there's a few mechanisms by which GME is funded, but overall, like I said, we've been hearing some interest in just how that happens and potentially any reforms around that. So we just wanted to have a space where we can open up the dialogue around that. But what would really be helpful for us is to understand the level of interest and what sort of topics specifically hospitals might like to hear about in those. So we invite hospitals to please email the address listed on the slide, that HCPUF_hospital regulatory email address, by April 3rd. What we're trying to do is, again, gauge the level of interest, figure out what sort of topics we might need to discuss, and who from the department we might need to invite to those meetings in order to best address some of those concerns. So right now, this is very much in its infancy, but you can help us make these meetings successful just by giving us some more information about what we can go over. So again, just want to emphasize, please email the address listed on this slide by April 3rd, and that can help us coordinate and figure out whether this is something we want to pursue as a breakout meeting from these hospital engagement meetings or as part of the regular cadence of these meetings. All right. And I believe that Diana has the next slide. So let's move to the next slide and I'll pass it to Diana.
Hi, everyone. This is Diana Lamb. I'm the inpatient hospital rates analyst. And I just wanted to give a quick update on APR-DRG version 42 update. Just so everybody knows, we're working on the analysis now that sets the new weights for version 42 to be budget neutral. So that is the same as spending that occurred in version 40. So basically the data set, and we'll go through this in May as we walk through this, but the data set will consist of in-state hospital claims from 7/1/24 to 6/30/25, adjusted for payment using APR-DRG version 40 and version 42, the new rates, using 10/1/2025 base rates. Payment differentials by major diagnostic category and by hospitals with the systems will be presented for hospital review during the May 1, 2026 hospital engagement meeting. Just so everybody knows, we'll go over more notable changes from version 40 to 42, but we're not going to go into the extreme detail we did since we had such a huge change from version 33 to 40, but we'll certainly be bringing up stuff. Everybody should know big changes. Additionally, we're currently planning to continue the same policy adjustments from version 40. Next slide, please. So here's the timeline we've got put together. Again, we're going to present everything to hospitals on May 1st, hospital engagement meeting. And we also will have the new weight table up as of May 1st for hospitals to review. This year, because of the timeline, there's been a lot going on here. I think everybody knows that. We're going to have a 15-day hospital review in order for us to be able to make the October 1, 2026 effective date. We did push that out just because there's been so much going on. And this is what will allow us to be able to make that deadline and have hospitals take a look, get back to us, respond as necessary, and then get it through to Gainwell, the new weight table submitted to them. They have to do testing and all of those things to make sure everything's working correctly and is ready to go on October 1st. Our intention is to not have to reprocess any claims. We want to just turn it on October 1, 2026. And that's pretty much all I've got right now, but we're working furiously to get that all ready for you during the May 1st meeting. And if anybody has any questions, you're welcome to email me or shout them out now. But otherwise, I'm going to pass it over to Sean next.
Thanks, Diana. Yes, I'm Sean Bashke. I'm the outpatient rates analyst. Just a couple reiterations with EAPG and some updates as well. So our EAPG rate changes effective July 1st, 2025. we have had those three changes of 1.6% rate increase for the base rate. At the same time, we reduced the 340B drug rate reimbursement from 80% down to 65%, as well as introduced the APG version 3.18. One change was implemented effective October 1st, 2025, which was the rollback of the July 1st, 2025 rate increase per executive orders. System change requests were completed on December 17th, 2025, with a total amount of claims that were reprocessed being 749,355. This was completed as of January 23rd, 2026 financial cycle. This email was sent on December 31st, 2025, describing these updates. If some of those claims are not pricing as they should under EAPG 318 or any other issues you may come across, please email us the ICNs of those claims so that we may review them. Next slide, please. For the EAPG module update, 3M Solventum released the Service Pack 2026.0.2 on January 15th, 2026. This was also installed on the same day on January 15th, 2026. This helped apply any new updates to the annual CPT and HCPCS. Impacted claims will be targeted for adjustments as well. Then the 3M Solventum did release general availability version 2026.0.1.0. This is the upcoming general availability version that's going to be slated for March 26, 2026. This is the estimated installation with an interchange, hopefully within the same week. Applies any quarterly CPT HCPCS updates as well. And that is all I had on my side. I believe it is Divas. No, sorry, Andrew. Andrew's next.
All right, thank you, Sean. So I'm going to go over just a few of the regulatory updates. We still have a few state plan amendments that are outstanding with CMS right now. So included in those are the 340B rate reduction. So as Sean mentioned, we are still moving forward that reduction from the 80% to 65%. We're just waiting for CMS to approve that. They're currently requesting some additional information on that. And so we've been working with them, having some back and forth to make sure that that moves forward. But also another state plan amendment, which is impacting hospital rates, as mentioned earlier, is that 1.6% rate increase, and then the corresponding decrease, or I guess rolling back of that change, effective October 1, which we're working to allow as a sunset to that original state plan amendment. So the last that we understand is that that is also in that request for additional information status. So that has yet to be approved, but we are working and continuing that dialogue with CMS. Next slide, please. So then continuing that trend, we did have the inpatient rebasing that was effective July 1, 2025, that we also have a state plan amendment for. Similarly, in that request for additional information status, that is, there are some holdups on the not necessarily from the CMS side, but just trying to get our ducks in a row from the compliance side and that state plan. So we're still working to get that done, and hopefully we have those approved in the very near future, and we'll keep everybody updated on that. We also have an upcoming rule change. This is what Diana had brought up during the November 2025 engagement meeting. These are purely housekeeping in nature and will be presenting to MSB on the regular rulemaking timeline. But ultimately, we were reviewing the rule, and there were a few things that we just needed to update. I believe that they were references or the numbers on or lettering on some of the actual rules were out of date. This rule change has no actual impact to rate setting and is purely to make the rule more readable. So we will, once we get a more definitive timeline, once that starts coming up, we'll keep everybody apprised of those details. But otherwise, if you want to know more about the specifics, you are encouraged to review the November 2025 engagement meeting where we brought this up in some more detail. Okay, and next slide, please. I believe this is Diva's slide, so I'll pass it to Diva.
Thanks, Andrew. Good morning, everyone. My name is Diva Wood, and I'm a hospital policy specialist here at the department. During the public health emergency, or PHE, there were several emergency and permanent rules that were passed. We're doing this rule review to ensure that emergency rules that were temporary were allowed to expire, and the permanent rules that were already stakeholdered and passed are present in the current rule. This will ensure that our rule is aligned with the state plan amendment, or SPA, and other regulatory provisions. Again, we just wanted to give you all a heads up of what we're currently working on, and we will share additional information once we know more here in this hospital stakeholder engagement meeting. So that's all I have here. I'll now hand it back over to Andrew.
All right, thank you, Diva. And as mentioned at the top of the meeting, it was a very brief agenda today, so that was all that we had prepared. However, certainly want to invite any hospital stakeholders during this time to ask any questions that may have been brought up or just anything else that's on your mind, or if you have any other comments or anything else to discuss. So go ahead and stay silent for a moment here. All right, so I'm not seeing any hands raised or anything in the chat. Okay. Well, as I mentioned earlier, brief meeting. If anything does come to mind, we have our email addresses listed here. Certainly encourage to keep any conversations going. Certainly feel free to email any of us. During our May meeting, we have plans to go over that APR-DRG version 42 update, and we'll probably plan to see you then. So thank you again for your attendance, and please enjoy your weekend. Thank you so much, everybody.